Hey guys, Dr. Lera here. And so I am here with Abby. Abby is a 7 to 8 month old Dogo Argentino. And Abby came in today because she has a dun laceration or a cut on her arm. All right, so lacerations. First things first, if you get what's called a clean laceration, which means it's on a piece of glass or a knife or something that is clean, then you typically have about 8 hours to go ahead and get that closed before we go ahead and then start getting into the viability of the tissue not being good enough for what we call primary closure, which means we get the two ends of the cut skin and we stitch them directly together without doing anything fancy. If it is something that is dirty, like let's say a piece of metal or I don't know, like a piece of wood or something like that, and then you have a dirty laceration, then you have maybe 6 hours, or actually they say they want a delay of 6 hours before you consider going ahead and doing the laceration. My anticipation for that recommendation is because they want to see if anything's going to kind of fester and that kind of stuff. So with this particular case with Abby, it is a clean cut. It's within that 8 hour window. So we're going to go ahead, we're going to stitch it together. That being said, when we go ahead and we come down here, heads up, it is a little bloody, not a ton, but a little. You can see this is the actual opening right here. And so that is something when it's more than, I want to say, than maybe a centimeter or half an inch, you're probably going to want to go ahead and stitch that closed. Now, you do have 3 options in regards to how to approach lacerations. One, you can go ahead, leave it alone, see if it heals, keep your fingers crossed, and it'll heal, but there's an increased chance of infection, complication, that kind of stuff. 2, you can go ahead and put some sort of bandage on it and a cone, and that's to go ahead and minimize the amount of stuff that gets in there. You don't have to put them under anesthesia or any sort of sedation or anything like that. And so you still are going to have to let that heal by what's called second intention, which means that granulation tissue or scar tissue is just going to fill the gap. And third would be actually sedating them, putting them under anesthesia or, heavy sedation. Depending on how long it's been since the laceration, you would either go ahead and just stitch it together with the same edges, or you would have to go ahead and freshen up the edges, whether that's actually cutting the edges of where the laceration is and getting bleeding edges so you have nice fresh edges, or just going ahead and getting a scalpel blade and scraping the edges till you have bleeding tissue. And then usually that's enough to go ahead and provide fresh enough blood supply to get the wound to heal. So today, the owners have asked us to see if we could go ahead and avoid sedation, potentially try gluing it back together. We will see how that goes. You keep tuned, and you can leave some comments and ask how it went. We will answer that question once, so please go through the comments to find it. Thanks for watching. If you found this video helpful, give us a thumbs up, subscribe, and if you know somebody who needs to see it, share it with them. Thanks a lot. Bye-bye.